Hi everyone, I'm Trevor Adam, East Wimmera Health Service CEO. Today we want to share information and answer some common questions in relation to our primary care transformation project. Our communities are facing multiple challenges, including ageing populations, declining numbers and high levels of a range of health conditions. These conditions include heart disease, diabetes and obesity. Strengthening community-based primary care will mean we can treat more of these conditions in the community and keep people living well at home for longer.
Our transformation has an overarching goal to implement an integrated model of primary health care. It will involve nurses, allied health, home care services and GPs.
Importantly, we're taking an organisation-wide approach to deliver this change for the communities we serve. We have established a set of principles so that our new model of care works for our consumers. It will be centred around consumer needs. It will involve various healthcare professionals delivering your care. It will be more accessible, and our new model of care will attract and build a strong health workforce that integrates the technology we use and have.
To do this, we are taking the time to understand and identify opportunities for improvement with our existing process and practices. We're building collaborations with general practitioners and their practices, and where we can't provide the service ourselves, we're establishing partnerships and affiliations with service providers and specialist services.
East Wimmera Health Service is positioned for change. We've launched the Change Catalyst. It is a redesigned program which involves teams from clinical and non-clinical areas. The program runs throughout the year and has an improvement approach. We're bringing together staff and consumers who are involved in specific processes to map out the steps to observe how work is actually done, and then we're defining those processes in detail. By using existing data and direct observation, we're able to assess the impact of our improvement program. And from here, we'll develop and implement improvement solutions. We want to ensure we evaluate the impact of any intervention and changes. This will make sure that as we gradually transition to a more integrated model of primary health care in our communities, it will be sustainable and something we can maintain.
Primary care includes services like regular checkups, treatment for common illnesses and injuries, and help managing chronic conditions like diabetes and asthma. It's an important service because it helps people stay healthy and addresses health problems early on before they become more serious.
Primary care services currently provided by East Wimmera Health Service include planned activity group, cardiac rehabilitation, counselling, mental health services, diabetes education, social work, physiotherapy, occupational therapy, podiatry and dietetics. We also deliver home care services such as personal care, domestic assistance, home maintenance and delivered meals.
During the next 2 years, East Wimmera Health Service will strengthen primary care for our communities by delivering healthcare through GPs, nurses and several other allied health services. As more people access these services, fewer acute hospital stays will be required and the number of beds being used will change to reflect the shift in care. To support the transition to a strengthened model of primary care, East Wimmera Health Service will need more healthcare staff, not less. The changing model of care will not result in staff cuts. Acute care will continue at East Wimmera Health Service. Primary care and acute care are both essential services for an effective healthcare system.
The move to a strengthened primary care model will increase the number of services we can provide to our local communities and enhance their overall health and well-being.
As we launch new or improved services, they'll become available one by one, and we'll let our communities know about this as they happen. Communities will be able to access some services face-to-face, while others will be accessed via telehealth. Depending on how the model of care evolves, we're seeking to offer a single point of entry for our communities.
We are making this change to help us respond to real challenges facing our diverse and remote communities, including ageing and declining populations and high levels of chronic health conditions. Investing in a new model of primary care will build capacity in communities across the region and help us change our focus from treating illness to investing in wellness.
Adopting a strengthened primary care model will ensure long-term sustainability of our health service by optimising the skills of our limited healthcare workforce.
By adopting this model, we can deliver more affordable, personalised care to a wider range of people, no matter where they live.